Deputy Gino Kenny. Gino, if you want to forsake the 30 seconds, and
I will.
There are only 3 minutes, and take your minute.
I'll listen to the Minister's answer and then I'll come back.
Thank you, Minister.
Expedite things.
Thank you, Deputy Kenny. As I discussed with Deputy Cullinan earlier on, I recognise the importance of student nurses and midwives completing their essential clinical placements in a safe environment. During the first surge of COVID-19, it was not possible to facilitate student placements from April onwards. This was due to redeployment of staff, including senior nurses, who would ordinarily be supervising the students. There was a particularly high rate of absenteeism, and the HSE's directors of nursing said they could not ensure clinical placements were protected. There were fears hospitals could be overrun. At the time, there were up to 900 COVID patients in hospital. Thankfully, the situation has improved. As of Sunday, there were 232 COVID patients in hospital. In April, deputies, students were offered healthcare assistant contracts to work and contribute to the national effort. Approximately 1,350 of the 3,200 first to third year students took up the HCA roles and contributed to the national efforts. All fourth years were also paid at the HCA rate. Given that working as a healthcare assistant does not provide student nurses and midwives with the structured educational outcomes that are part of a graduate programme, it was important to have the students revert to their educational placements as quickly as possible. The HSE's directors of nursing have said that all student placements have now fully resumed, and it's imperative that educational placements are protected for exactly that, for education. Payment at the HCA rate was made during the first COVID wave because the student nurses were working as healthcare assistants. We do not want the student nurses or midwives working as healthcare assistant. We want them being full-time students on educational placements. The colleges who have primary responsibility for these students have not contacted me, have not contacted the Department of Education seeking payment as healthcare assistants. In fact, my understanding is the colleges who are primarily responsible for these students and obviously fully responsible for their education are firmly of a view that these placements are clinical educational placements. They must be protected as that, and they do not want to see their students paid as healthcare assistants.
Deputy Kenny, you come back in for a comment.
Just one, I'll use 1 minute. Minister, I think there's been a lot of commentary and a lot of criticism of the government in relation to how student nurses are treated, even prior to COVID-19. And if there's anything that can happen out of this situation, particularly around the review, is actually how student nurses and nurses are actually treated in this country. They're extremely dedicated to their vocation. The last 9 months have been unbelievably challenging, not only for them, their families, but the people that they care for. So hopefully that review identifies a number of things. Identifies that student nurses, when they're on placement, and I understand, I was a HCA for a long time prior to being elected, so I understand how student nurses are on placement, and it is an educational environment. But it's also an environment where they do a huge amount of work that HCAs do, and that should be compensated for, and it should be remunerated for. Because retention of nursing is so important, Minister, in this environment. You know, nurses, when they graduate, want to stay in this country. They're so proud of their job, but they want to stay in this country. But they will not stay in this country if they're constantly exploited and not being respected. So I ask, Minister, I plead with you, under this review, that student nurses are properly paid
Deputy,
in relation
we're way
to their
over
job.
time. Thank you. Thank you very much. Minister, we're over time, so just a brief comment. We're going into leaders' questions. I'm sorry.
Okay, well then,
if you want to make a brief comment, you're
I don't know. Will I take 60 seconds or not, Chair? I'll need 60 seconds to respond, but if I don't have it, that's okay.
We don't. We're actually going into leaders' questions.